Well, good morning and welcome to The Gift of Life. I guess I probably should just simply say good day because I'm not sure when it will be airing, but this is The Gift of Life for you. And if you remember, any of you who are watching the program at all, you'll remember that when we did our kind of demo with Tony, we came up with a title of the group of women called WOW, which stands for Women of Wisdom. And I am one of those, which is Deborah Hollis, and then my guest today is another one, who is Shirley Ross. And I'm very happy to ask Shirley to come and be with us today and talk somewhat about her hospice experience. But I'd also like to share with you that, as coming from a medical background, that when hospice first started getting started, so that's going to kind of date me, but anyway, when it first got started, we were doing hospice and nursing anyway. We just didn't call it that. So I have had the wonderful experience of learning from Dr. Kubler-Ross. I remember a time when she came to Kennebuck and went to listen to her and talk with her.
I didn't know that.
Yeah. And so I've always been very, very interested in talking to families about the hospice care and helping people in death and dying, whether it be actual in my nursing career or whether it actually be with friends. And so when I met Shirley and her experience about hospice, that was a little bit different and changed my picture. Also learning with my mom and having a personal experience with that. But we're here for Shirley today, and I would like to ask Shirley to share her experience both in when she was a volunteer as well as what she found out in her own life and how that has touched you.
Thanks, Deborah, for having me. To begin with, yesterday I was visiting with a friend who has Parkinson, and we were just kind of sharing, and I went to school with her, and we were just kind of sharing life and trying to catch up because I hadn't seen her in some time. And before I left, I'm not sure how the subject came up, but I said, well, excuse me, I am no longer involved with the hospice of Southern Maine. And she looked at me and she says, hospice? What's that? Well, my heart went right down to my toes, Deborah. I truly wonder what it will take to get the word out of what hospice is and what hospice entails. And as much as I think, because I've been in it for 12 years, because I've been in it that length of time, I assume that maybe people know a little bit more about it than what they actually do.
That's a good question. I think that that's a really good question, that we need to define what actually is hospice. So how did you answer that,
Well,
Shirley?
truly, I have no clinical background, and so I come from it as a hospice volunteer who has received educational credits and gone through the program with Hospice of Southern Maine and Carol Schoenberg Robinson. And so I come from it as a layperson. In that experience, I had so many aha moments. Truly, in the first 2 weeks of the training, it's a 40-hour training session, subsequent Fridays, you know. In that experience, I thought, why don't I know more about this? Because when Elizabeth Kubler-Ross wrote her book on death and dying, and the 5 stages and all of that, I had familiarized myself with that work. I had looked into what the hospice concept started in, that St. Christopher's in England, you know. I had all of that background, but those were facts. And then you sit and you talk with the instructor and you find out just how little you know. And so my feeling was, in talking to my friend, there's still so much that's not known. So you ask the question, what is hospice? Hospice is compassionate care.
What a
If you were-
wonderful word.
You know, if you could define hospice, I think that that's where you would go with it. The nuts and bolts of it is if there's a hospice team, there's a doctor, there's a nurse, there's a social worker, there's a non-denominational spiritual advisor. There's the hospice volunteer. If it's needed, there's a home health aide. Oh, wow, that means that if my mother or my sister or my brother gets sick, then I don't have to worry about having a caregiver because hospice will come in and do it all. Well, no, hospice does not do it all. Hospice does their piece of the puzzle, and each person who's on that team has their piece, and it's quite a magnificent piece. I've had the personal experience with that. So, what have I learned? I think one of the most significant things that I've learned, Deborah, is that you have a team of people who totally respect a very vulnerable time of life. When hospice says it's a 6-month diagnosis, well, a 6-month diagnosis, am I going to die in 6 months? You know, where does this all take me? No. In order to meet a criteria for hospice, it's a 6-month window. They don't kill you if you're not there in 6 months. If you're still
I'm
there.
really glad to hear that.
Yeah, you know, it's and though that there is misconceptions, and the misconceptions, there's a myriad of them, and I couldn't possibly go through all of them. And I am not an authority to be able to tell you that either, by the way. You know, there are some people that have studied it and been with it and continue to serve in what I think is a magnificent way.
Well, one of the things that that you spoke about, I think, is also very important. I liked what you said about the training that you were given as a volunteer, which was 40 hours. So sometimes we think 40 hours for someone who is retired, well, that's, you know, like a whole week, and I don't want to do that anymore. So how did that work for you?
Well, Carol Schoenberg Robinson was the trainer, and at that time we went to Saco Valley Hospice in Saco, and that's where I got my training. You know, it had not become Hospice of Southern Maine yet. It was still another agency. And when I was going into retirement, a very fine time, I knew I wanted to do something else based on a life experience of when my own dad died at the age of 66, and at the time I was 31, and I've alluded to that in the past, I believe, on this program. Deborah, I had no more skills to be able to deal with him the morning that he said, "Shirley, you know I'm dying." And my response was, "Oh no, Dad, don't say that. You're gonna be fine." Well, I closed the door to any discussion that might have followed. My sister, Evelyn Robichaud, was a lot wiser than I was, and 5 years older, and with experience, I think, a lot greater than mine. And she did listen to what he had to say. I said before, Deborah, that it's a vulnerable time of life. There is no more vulnerable time of life than that. In my opinion, from my experience as a volunteer and going into the homes of many people, they don't need you to solve anything. They need you to be present to them.
They do.
And sometimes that means that you're going to chat, And sometimes that means that you're going to be quiet, but you give them the opportunity.
One of the other things that I found, well, first of all, you commented about the criteria being that you have 6 months probability. But that doesn't mean that it has to be 6 months. It could be, the doctors do their best in any kind of estimation, but it could be as long as 2 years or more. And what I have experienced, and I ask you if you have, is that I think there's a resistance to allowing a hospice intake person to even come in and start the process because they're thinking, this means I'm going to die in 6 months. Whereas if they came in, it might improve this quality of life, this last period of time, to such a point that there's great healing for the entire family. But there's this resistance to allowing that because of the criteria and saying, well, I'm going to die in 6 months and give up.
Yeah. And give up. Yeah. You make good point. How do I want to put that? Had I had the courage yesterday to mention to my friend, have you considered hospice? I would have had a lot of background work to do because she didn't know what hospice was. During that training, I found out that it's okay for me to be in charge of my life as it responds to my health. And that means that I had the freedom then, and I did. Did I? I went to my own physician and I said, Doctor, in the event that, I wanted to be very clear that if I had a what used to be called a living will, and now it's called an advance directive. This advance directive, this living will, simply outlines what I, myself, Shirley, want to have happen to me at the end of my life. Do I want extraordinary care? Do I want this? Do I want that? Do I want that? Oh, what kind of a funeral do I want? And I found out it doesn't make anything happen. To be planning that is like, you're planning a trip to Czechoslovakia.
I am.
Well, you could be planning for the end of your life and outline exactly, if I don't come back from Czechoslovakia, I want everyone to know that this is what I want. And I want this funeral. I want this music. I want these readings. It gives you control.
See, isn't she amazing? She took the words right out of my mouth. I was going to tell you that that's a good time to take a look at what do you want in your life, because you just never know. And even the tour guide had recently said to us that there was a gentleman that on his last tour had a pre-existing heart condition, and he ended up being in the hospital and had to be air-vac'd home. And that might have not had that kind of results. So if those things had been taken care of, then anyone, especially family members, don't have to deal with it during that crisis time. And so, by doing all of that, it opened up avenues to your physician to let him
He was relieved, Deborah.
Yeah.
He was relieved. He said, well, let me be clear, so we clarified. Now, I had a new physician subsequent to that one. Back to that conversation, these are my choices, I'm not leaving anything to chance. What you said prompted me to have a thought, and let me see if I can regroup that for you, Deborah. The age to prepare an advance directive is at 25, and you revisit it at the age of 30. And with technology moving the way it does, you review it often. Yeah. And you don't tuck it into, when I was working for an attorney, we did a lot of living wills along with the power of attorney and all of that stuff, and wills, that kind of thing. And one of the things that we did was we tucked it in the vault with the will. And that person might have had a copy of it, of course, but that copy went into Never Never Land. I was teaching medical terminology one year, and I was talking about advance directives, preparing for the final scene. And I was looking at adult learners with a lot of ho-hums, oh gosh, we're going to talk about that. I don't want to talk about death and dying. What's the matter with this lady, Why is she pressing that on us? That was on a Tuesday night. And we met again on a Thursday night. And a daughter-in-law and mother-in-law came rushing up to me in the hallway, and they said, Shirley, you're not going to believe what happened. I said, well, tell me, what happened? Wow, I can't tell you. We'll have to wait till the whole class hears it. Okay. So now I'm curious, right? We get into the classroom, and I said, would you like to share? Wow, do you remember what you talked about, the advance directive and all that stuff, and you're wanting to know what people want to do at the end of their life, blah, blah, blah. She was going on and on. I said, yes. Here's a sad part of this story. The mother-in-law's nephew, age 21, in Boston, Massachusetts, was in a horrific accident and was on life support. And they had no idea what that young man wanted, to extend his life or to let him go. And that's a decision. That's not a foregone, we're going to do this, we're going to do that. So the responsibility was on the parents to be able to figure out, what do I do with my son? I don't know what he would have wanted. And that's probably the strongest example I have of the necessity to prepare.
So how would someone who might be interested in more information about hospice, how do you think that they should go about doing that? What are some of the resources that you would encourage them to reach out to? Because as you have said, you are not an expert. You just are talking about your personal experience.
That's it.
So what are some of the places that you might suggest that they go to?
First of all, it's going to be at your doctor's office. And if you don't need to see a doctor, you can get a copy at the hospital or any medical facility, as a matter of fact. Because these days, you do not go into any kind of surgery without having an advance directive. And if you're going in for a gallbladder operation or a hysterectomy or a tonsillectomy, it doesn't make any difference. You're going to have to say, in the event that the anesthesia goes south, what do I do? So it would be, to begin with, if you asked your doctor, Deborah, for an advance directive, or if you want to use it, a living will, whatever you want to use, you're opening the door to let that woman or that man know where you're at. So that if they see you in an emergency situation, they know where you're at. So the place to start, I think, is with your doctor. Okay. It's not an easy discussion to have, I don't think, If you're 25, it's a whole lot safer than if you're 80, don't you think?
I think so. Mm-hmm. And I think, the other, we were talking before we went on air about travel. And again, you heard that I was going on a trip. And that's important to have that in place and to also know of where you're going and whether or not they will honor those wishes. So that's another thing, because different states as well as different countries honor things differently. So that's as far as, and the advanced directives. And most hospitals too now have them readily available.
At the desk.
Right.
At the volunteer desk.
But if someone were interested in either as a family member or as for themselves in looking into hospice, who do you think that they should contact? Who would be some good?
Back to the doctor, Deborah.
Back to the doctor.
The doctor is the one who will make the reference.
Yeah.
You cannot call hospice and say, I'd like my sister to be on hospice. You need to have that documentation from the doctor.
Okay.
Does that answer it?
Well, I think I was looking to, where they could get more information without necessarily going to the doctor, just on hospice per se. So I was thinking probably like Hospice of Southern Maine, or just Googling, if you have a computer, the word hospice to find out information, about that. And if someone had a desire to, as you did, to go and do volunteer work, because I hear a lot of different people talking about they would like something to do, because as you retire, that doesn't mean that that's the end of your life. You have so many gifts that each one of us is given that you can use. And you mentioned also something about how you had done some theater work in educating people with hospice. And so
Hospice of Southern Maine, Jill Bixby, who is a nurse educator up in, she was in the Waterville. She travels. I'm not sure where at the present moment she's located, but Jill Bixby had the responsibility of education. And she had a workshop that was coming up. And they were near the water, and there was a lot of the docks liked to sail and stuff, And so she was trying to think, how am I going to get them off the boat and into the conference, to be able to get this end-of-life series. And so she went to bed one night and woke up in the morning with all these words flashing in her head. And she's, I think I need to sit down and write this. So what she did in the course of, she told her secretary, I'm closing the door, I'm going to be busy all day. And she sat down at the computer and typed out the final copy, the one and only copy of a play entitled Boating, which is kind of misleading, because what she was doing was trying to attract the docks with boating. Oh, what's that going to be all about, right? Actually, boating stands for before offering another treatment, identify new goals. That's boating. Before offering another treatment, identify new goals. So I'm not sure what the connection there was with Carol Schoenberg Robinson. However, they're friends, and perhaps Jill might have told her about it, and Carol took the ball and ran with it. So she asked my friend Florette Bannon and myself, and a woman by the name of Anne Murray, and a nurse from their agency, Pam Doyle, Carol putting together the team, whether or not we could maybe present this as an educational piece. Well, little did we know. And I'll tell you a little experience about that. My role was to be the spirit whisperer. And the first time that I had to say, are you comfortable? I was supposed to be whispering it. And so are you comfortable? And Carol, who has some theater background, came up with a rolled piece of paper, and she says, I'm going to give you a megaphone, because if you want the last person in the last row to hear that, you're going to have to speak up, you know. So it became a joke to me. Oh, geez, I've got to remember to try to project a whisper, you know. It turns out that we have done it, what did I say, 125 times? That's conservative.
Yeah.
In the state of Maine, we've gone to Philadelphia, we've gone to Washington, D.C. Jill Bixby took it overseas, you know, as the creator of it. So it has proven to be a nice educational piece that allows the people in the audience, the people who have come to see the play, to ask the questions and maybe to surface something that maybe they might not have surfaced previously. And it's all done analogous, you know. I can't really explain all of the dynamics of the boating scene, but I can tell you that it is theater script. The script is Reader's Theater, so we have a script. We have a doctor.
Can you describe that just a little bit? What's the Reader's Theater? What is that?
Okay. Reader's Theater is on stage with copy.
Oh, you mean I could do that?
You mean
so I don't have to memorize all those lines?
Oh, no.
Oh.
No. Yeah, and as a matter of fact, I've followed through with that, because 4 years ago, I decided to get into theater in Portland and in Sanford and in Springvale. So it was good. It was a good first step. So if someone sees the play, if they hear Carol explain some of the ramifications of illness and so on, it is such a powerful experience, I guess is a good word. It's a powerful experience, but beyond that, there's something that touches the heart. Yeah, there's something that touches the heart, and it feeds the soul.
So that goes back to our compassionate caregiver.
That goes back to the compassionate care, yeah. Now, I was a hospice volunteer for others for 10 years. Then I became a recipient of hospice services when my husband was entering into his last days. That's the piece that will forever have reside in my heart because of the hospice experience, because of the hospice education. I did educate myself. My husband, Ernie, became the recipient of all of that experience that I had had with hospice. And the D word, death, was not a stranger in our house. If I had a patient that I was sitting with and I would come home, maybe that would be supper time sharing, not of names, because you kind of keep that privileged, but of experience, you know.
So you educated him through your conversation.
Through conversation, yeah.
Which is what we want to do to all the people that we come in contact with. Just through conversation is to educate them to what is available, not only as a volunteer, but as someone that may use it for themselves or their family members.
Yeah, and it's very likely, Deborah, that if you're a hospice volunteer, that at some point it's going to hit home pretty close. Mm-hmm. In Ernie's case, he was a warrior. He fought illness for 17 years. And when they said there's no more hope, somehow or other, he always found that energy to come back. He was what I call a jock. He was an athlete, and he took good care of his body.
He certainly did.
Yes, he did. I loved him so much. Yeah. And so when, at the end of his life, the last challenge, the last medical challenge happened, he could see the writing on the wall and said, "No more." I said, "What do you mean, hon?" "I'm telling you right now, I'm done." "Well, you have to have the CAT scan and you have to go see the doctor." And no, he says, "You didn't hear me. I'm done." Done. I swallowed.
I was going to say, that must have been hard to
I
hear.
swallowed, yeah. The next thing that came out of his mouth rather astounded me, and he said, "I want hospice." I said, "Honey, you can't just say, 'I want hospice,' and it's going to magically appear." "No," he says, "I'm telling you right now, I want hospice." Now we go back to the doctor. The doctor, Ernie's decided that he'd like to share with you some pretty serious stuff. Yeah, what is it? Yeah, well, he's doing quite well. Well, we're going to try this, and when he needs to do that. And Ernie looked at him, he said, "No. Hospice." "Well, now, just a minute, Ernie. We're not at the end of this whole thing now. We need to be talking about this." And Ernie says, "Hospice." "Well, let's see. There's a case manager that I can't go to your house, but there's a case manager that I can send to your house and see where we stand with that, because that's not possible." Fine. So the following day, this lovely, lovely lady named Barbara came and sat with Ernie. And in spite of the fact that he had had 2 strokes, he was able to verbalize as if it was a textbook. He had it all down pat. "This is what I want." And Barbara says, "Well, you're pretty clear, Mr. Ross, why don't I go with you to the next doctor's appointment?" And so we made an arrangement for the following morning, noontime, to go to the doctor's office. And she was the silent observer. She was not participating. She was there as a witness to what he had said, because his communication skills were challenged. And so, long story short, but it's too late for that because it's a long story, Dr. P said, "Let's talk about," and he gave him alternatives, and Ernie kept saying, "Hospice." Well, he got hospice.
I think, I want you to finish the story, but I think this is a very, very valid point, that Ernie, in this case, really knew what he wanted.
Yeah.
But do you see how much he also had to educate the doctor? Because also the doctors and nurses, they have their own feelings.
That's right.
And their concerns, and their job is to promote life.
That's right.
So sometimes you need that advocate, and that's what the nurse manager and his wonderful wife were in this case, to be able to step in if necessary, but he was able to say what he wanted. So I say to all of the nurses and physicians and other caregivers that are out there, listen to what your patients want. Yes, you want to offer them, alternatives, but if they really know what they want, then listen. That's as an important a job for any caretaker, any individual, no matter what the situation is, whether it's a respiratory therapist, an x-ray technician, doctor, caregiver, friend, social worker. It's the listening, hearing what the patient and what the individual is saying. So finally he was heard.
Mm-hmm. And the doctor later thanked me. He said, if people were a little bit clearer of what their wishes are, it would make my job, and I had heard that so often in the training, in the doing the boating play, Oh, there was one doc from Sanford who said, oh, don't I wish I had had this behind me this week with this patient. So it's not, we're not in Never Never Land. We're in reality, you know. And to reinforce what I said before, Deborah, hospice to me has come to mean cherishing life until the last breath. When the hospice team came in, I was fortunate that I was home and I could be his primary caregiver. Not everyone is that fortunate. But each person that came in with their focus was on the patient. When the patient wasn't present to the environment we were in, they were present to me. And in this day and age, it's very hard to have somebody focus just on you or just on the patient. So it always touched my heart. It always touched my heart to be a witness to that.
Well, I thank you, Shirley, and I thank you to end on such a wonderful, positive note. You know, that again, in listening and focusing on the person that we're with at the time, both in hospice and in daily life. So remember, this is the gift of life for you. It's your life and what you want to do with it. Please feel free to email me or call me if you have any questions or would like more information or want to talk about something different on our program. So I look forward to our next time, and I look forward to hearing from all of you. All your thoughts and ideas are wonderful. Thank you. God bless you.
Thank you for
Shirley.
having me, Deborah.
Thank you.